If you get a headache every week, I would consider that frequent. That's not normal. You should not get a headache. Some people have hormonal headaches. Some people have headaches from stress. Okay, those are addressed, with hormone therapy or with meditation or acupuncture or psychology. But for the most part, most of your headaches that reoccur are usually from tight muscles from neurologic or biomechanical imbalance. And once we get in there and change the picture there and give them some exercises, the headaches are pretty much gone. As a chiropractic neurologist, we really focus on not just clearing your headache, but finding out what's causing these problems to trigger the headache. It could be allergies. I do nutrition allergy. It could be that. And many need an adjustment. So we have to kind of dig a little deeper and figure out what is the trigger for these problems they have. Recurring headaches are typically tight muscles. Again, we can have hormonal issues or psychological stressful issues, or as simple as sleeping wrong or poor pillow. So we kind of like, when I take an inventory of someone's situation, we look at their work, their sleep, their activity, their nutrition. We kind of take a whole look because we got to figure out what the heck's going on to get them to where they want to be pain-free. Recurring headaches, again, could be from nutritional deficiencies, allergies, alignment issues, biomechanical neurologic imbalances, stress, hormonal issues. Again, sleeping habits, work habits are very classic, actually. So we take into account all these environmental activities that a patient has and try to get them to change so they can have a pain-free life. Typically, when I work with headaches, again, I try to get people better in 6 visits or less. Some people take more. It really depends on the situation with the patient, their genetics, the type of headaches they have. So some people come to me once a month or twice a month because they don't get headaches if they do. If they don't, then everything tightens up and then they get headaches. So there are cases where people have to come in regularly to treat their ongoing recurring headaches because nothing else helps them. Medication makes them sick, or they can't function normally, and adjustments, and they do fine. Or we usually allow to do adjustments in acupuncture for headaches. The important thing is about recurring headaches is manipulation generally does really well with that. There are certain cases where we have to go with looking at environmental things like sleeping habits, work habits, exercise habits. Those all come to picture. There's also stress. So we look at, the most important thing is we take a look at the whole picture and figure out how we can change this situation.